Hello, and welcome to Observing in the Operating Room. University Hospitals has a large network that spans across Northeast Ohio with at least 16 hospitals containing operating rooms and PACUs. Observership is available at most, if not all, UH locations for OR and PACU. When applying or requesting to observe, make sure that you have a clear objective in mind for what you want to accomplish for your observation experience. Below are the hospitals within the UH system. Many roles qualify for observing in perioperative services. In the next two slides, you'll see the most common roles that are requested. In order to observe at university hospitals, you must complete one of two policies. GM38 is the policy to complete if you are interested in a career in healthcare. This is our healthcare career observation program. GM7 is for guest observers, meaning regardless of if you are interested in a career or not, you are able to complete GM7 to observe in a patient care area. You will need to have an identified sponsor or somebody that is willing to have you shadow them throughout the day, and a surgical service line identified while filling out these roles and forms. If you do not have a sponsor, you can reach out to the observation coordinator of the department. However, you must at least have an identified surgical service you are interested and communicate. Students currently in a clinical rotation through UH do not have to complete these policies, but you are required to watch this video and complete the quiz that follows. Once approved for your observation, you will receive instructions and a badge. You must be wearing your badge for your observation day. Depending on the entity, you may request your sponsor to meet you at a specific location to ease finding the ORs. If you know the hospital, you will report to the control desk and they will help you get scrubs and a locker to place your items in. For CMC observers, you will need to clock in at the volunteer kiosk on the first floor of the Lerner Tower building. You must be wearing your badge, or if you are a student, a UH issued student badge. Sponsored observers must be with their sponsor at all times. You must bring money for lunch or pack a lunch if your experience is going to be on site. Make sure that you are doing hand hygiene and washing your hands when entering and exiting rooms or after any interaction with a patient. The operating room environment can be fairly intense. It is important to understand what you are going into. If you are interested in a specific surgery that you have identified, it is recommended to look up the procedure beforehand so that you have an idea of what's going on in the room. Arrival time to all observers is typically between 6:30 a.m. and 7 a.m. Please arrive at the time designated by your site and or your sponsor. Make sure that you are eating breakfast. Usually there are vending machines and cafeterias on site, but just in case, it is always recommended to bring food and water with you on the day of your observation. When you are going into a room to observe, you must wear clean scrubs provided by the hospital, and we ask that when you report for the day, you wear either clean scrubs from your school or from your unit and business attire when entering the hospital. You must bring your temporary ID badge. If you are sick, please reschedule your observation day. We do not want to put the patients at risk. All entities offer a lunch. It's usually 30 to 45 minutes. If you remain at the hospital, you may remain in your surgical scrubs. However, if you are leaving the hospital or going outside, you must change out of your scrubs and into the street clothes. Please do not stay for any observation period after 3 p.m. Reporting to the OR for the day. You should report to the OR at the designated time. Please do not bring any valuables to the OR. Only bring what you need for the day. The locker that you use is typically a shared locker. Wear clean and comfortable shoes. Please do not wear anything with holes in them. Contact and report to the control desk. At the control desk, you will state your name, title, and your role as an observer. You're going to sign the observer book if the entity has one, or any other book that is required. You're going to obtain a scrub avail key if the entity uses one. Otherwise, you will report to the locker room and grab a set of scrubs. The surgical liaison will provide you locker information as well as the scrub avail key or the scrub avail code. After you've reported to the control desk, please locate the locker room to get your scrubs and change. Make sure that you keep your scrub avail code and your locker information with you. Please do not lock it in your locker. If you have a scrub avail key, it will be returned to the control desk prior to you reporting to your assigned room. Change into clean operating room scrubs. We ask that you remove dangling items such as bracelets, necklaces, earrings, and lanyards. Rings are also discouraged in the ORs as they can hold any bacteria. You want to leave any personal bags and clothes in the locker. Remember, it might be shared, so please leave any valuables at home. Place your temporary ID badge above the waist where it is clearly visible. Observers that have completed GM38 or GM7, you must bring the patient consent for an observer form to your experience. You are not allowed to enter the operating room without the patient having consented to you. The operating room is designated in 3 individual areas. The first is an unrestricted area. This area of the building is not defined as semi-restricted or restricted, and your street clothes are allowed. These are typically our break rooms, locker rooms, and in front of the control desk at some entities. Semi-restricted areas are areas that support directly the OR. You must be in surgical attire with your head and facial hair covered. A red indicator line on the floor is typically used to indicate a stop that you are about to enter a semi-restricted area. Examples include corridors outside of the ORs, scrub sink areas, and storage areas for sterile items. The third area is a restricted area. This is accessible only through semi-restricted areas. You must be wearing surgical attire as well as your mask. Operating rooms with sterile supplies or other areas with invasive procedures should be considered restricted, and you should have all full surgical attire on. Dress code for the operating room. You may wear clothing under your scrubs, however your t-shirt or any shirt underneath should not go past the sleeve, and the neck should not go above the scrub top. Grab an operating room jacket if available. The ORs can get cold and you are not able to wear any personal jackets past the red line. Semi-restricted attire is the image on the left. They are not wearing a mask. Restricted attire is the image on the right, where you can see they are in full surgical attire, including their mask. On the next slide, you will see a video demonstrating surgical attire and how to put your protective equipment on.
Okay, scrub attire. You have a jacket. If you don't have a jacket, that's fine. You have your scrub top, scrub bottoms. You can wear anything underneath the scrub top as long as it doesn't stick out of the sleeves and as long as it doesn't stick above the neckline. And then you are allowed to wear any bottoms underneath the pants. Just know the ORs can be a little bit cold. So for your surgical attire, you're going to grab a hat. Make sure all of your hair is covered. Make sure everything is tucked in. I like to cover my ears because I have earrings in. Then you're going to grab a mask, and there's a bunch of different masks that you can grab. But you're going to grab a mask, and you're going to make sure you're not going to wear it tied around your neck. You're going to tie it on.
Yes, this is the day I'm doing
So
it.
tie on above. And you're going to make sure it fits pretty nice to your face. You don't want it loose or anything like that. And then the next thing, while I'm grabbing those, you're going to grab shoe covers next. So shoe covers are usually on the bottom of the cart. They look like this. And I always like to find the line, and the line goes on your toes. So I just have to lean.
Okay.
Shoe covers. You should wear comfortable tennis shoes, nothing with holes or anything like that. And once you're all ready, you just do a quick head to toe check. You have everything you need, and we're good to go. Cool.
Physical therapy students and occupational therapy students or assistants will locate the surgery boards and find a room with cases that you would be interested in observing. Typically, these are orthopedic surgeries. However, it is anything that would be applicable to your school. Report to the charge nurse and state what room you'd like to observe in. The staff will help you to that OR. Make sure that you are in full surgical attire and have a mask ready to go. For all other observers that are sponsored, you are going to meet your sponsor prior to going into the operating room. Your sponsor and you should designate an area on where this will be for the meeting. You should be with your sponsor at all times during your observation. Check that you are in full surgical attire and have a mask ready to go. Make sure that your sponsor has received patient consent for your observation and that the circulator nurse has the patient consent. You are not allowed to be in the room without that patient consent. Observers are not permitted to provide patient care, help perform in any procedures, operate patient care equipment, or access the EMR. It is strictly an observation role. You are not permitted to scrub into any procedure unless you are a visiting surgeon. If any of these rules are broken, you will be asked to leave your observation experience. For physical therapy and occupational therapy observers or our nursing student observers, you must remain in one operating room. We ask that you do not hop room to room. If your room is done for the day with cases, you may report to the charge nurse and see if there is any other opportunity for you to observe prior to the 3 p.m. cutoff time. If you are a sponsored observer and your sponsor is done for the day, you must leave your observation experience. You are not able to report to another room. When you enter the operating room, please introduce yourself to the team. The team will help assist you with a safe place to stand at least 12 inches away from the sterile field. Please write your first and last name legibly on the whiteboard. We ask to also write a title, even if it's just observer, so that the circulator may put you in the chart. Give your sponsor the written consent form if you haven't already. It should be signed and it should be with the circulator. Do not walk between sterile objects. In the next slide, you will see a video of how to appropriately enter an operating room and where to report.
Okay, so entering the OR, you're going to make sure that you enter and you're going to avoid anything blue. So when you walk in, you'll see tables covered in blue, you'll see people dressed in blue, and you're going to keep a really far distance. And you're going to come, you never want your back to the table, so always make sure you're facing anything that looks sterile. And you're going to find the circulator area, and this is where you're typically going to stand while the case is getting set up.
What to expect with a patient. Patients entering the operating room are scared and awake. Please be professional and introduce yourself. Remember, the patient should have consented to you being there, so they should know that you will be in the room. The patient will be moved from the patient cart to the operating room table. A reminder, you cannot participate in any patient care, so please do not participate in movement of the patient. A safety huddle will be performed with the entire team. The patient, the procedure, the laterality allergies, equipment, and more are discussed. There is also an introduction at this time, so please take the time to introduce yourself. The patient will then be medicated and a breathing tube will be placed. Pediatrics do allow parents to go into the operating room with a white bunny suit on. They are asked to leave once the patient has a breathing tube placed. The patient will be prepped and draped, creating a sterile field. Staff will help you get safely closer to the field to have a good view. Please be cognizant of the sterile field, and remember, a 12-inch barrier between you and the sterile field is best practice. Do not be scared to ask questions. Once the surgical procedure begins, the team uses cautery, which has a strong smell. If you need to step out, please step into the hallway and remove your mask. If you are feeling lightheaded and can exit the room safely, you may and watch from the window for a moment until you have the lightheadedness go away. If you feel lightheaded and cannot safely exit the room, please alert the circulator immediately and place your back against the wall. Do not sit in a chair. It is possible to fall and hit your head. If you feel like you are fainting, lower yourself to the ground while remaining against the wall. Stable staff will assist you to the lounge and help you get a small snack and drink. Please let your sponsor know if you are exiting the OR for whatever reason. If you are a physical therapy or occupational therapy student or a nursing student, please let the circulator know that you are exiting the room. If we don't know that you've left, we might not know if you are injured or if you've gone home for the day. You may exit the operating room at the end of the case or during breaks. Please follow the lead of the team about removing your mask. Once you are out of the room, you can always safely remove your mask. Do not remove any hairnet or shoe covers until you are out of the restricted area past the red line or the sign that says stop. To leave for the day, obtain the Scrub-A-Vail key from the control desk if necessary, or use the code given to you at the beginning of the day. Go to the locker room and change. Please make sure that if there is a Scrub-A-Vail machine that you've taken your scrubs out of, that you are returning your scrubs to that machine. If the entity does not use Scrub-A-Vail, you will place in a blue linen bag or a bag clearly identified for your scrubs. All jackets should be going into linen bags and not into the Scrub-A-Vail machine. If you have a Scrub-A-Vail key, you will return it to the control desk at that point. If you have a code, you may return it to the control desk or throw it away. You must sign out of your observer book or whatever book you signed to get into the ORs. CMC observers, make sure that you sign out at the volunteer kiosk so your hours can be appropriately tracked.